Hello my dear friends, welcome to Nurse's Ladder. Today in this video I'm going to talk about different types of peptic ulcers. That is, first is gastric ulcer and the second one is duodenal ulcer. So gastric ulcer is a type of peptic ulcer which occurs in the stomach. That means it can occur in any part of the stomach. And duodenal ulcer is a type of peptic ulcer which can occur in many parts of the duodenum. Okay, that is a part of the small intestine. So let us go and learn what are the different characteristic features of these two ulcers and how do they differ from each other. So peptic ulcer is defined as an ulcer which is formed due to the corrosive action of pepsin and hydrochloric acid over the mucosa of upper gastrointestinal tract. So, upper gastrointestinal tract refers to esophagus, stomach and duodenum. Okay, so this is all about the definition of peptic ulcer. So, let's move on with the differences between gastric and duodenal ulcer. First heading on which I am going to talk is the age of these two, the patients who suffer from these two disease. First, in gastric ulcer, it is 50 to 60 years. That means elderly people are more prone to have gastric ulcer, whereas in duodenal ulcer, it is 30 to 40 years of age. And next, gender. Gastric ulcer is usually seen in female and duodenal ulcer is usually seen in males. And the sites of gastric and duodenal ulcer. Gastric ulcer, it is usually found in the gastroesophageal sphincter, which is also referred to as the cardiac sphincter. So it is located here. Okay, this is the cardiac sphincter. So here it could be found. Then after which it can also be found near to the greater curvature of the stomach. Greater curvature of the stomach. Okay, it can also be found in the lesser curvature of the stomach. Lesser curvature of the stomach. Okay, and also near to the antrum. Okay, so in antrum also, specifically if you see it usually occurs in the angularis. That is the angle part of the antrum which has an angle over it. That is, it is referred to as angularis. So these are the part or sides of the stomach where gastric ulcer can develop. Also, it can also develop in anterior and posterior walls of the stomach. So this is all about the gastric ulcer. What about duodenal ulcer? In duodenal ulcer, usually you can find a ulcer on the duodenum, specifically near to the pyloric sphincter. This is a pyloric sphincter. That is a sphincter. That is a sphincter which connects the stomach and duodenum, as well as it can also be found on the anterior wall of the duodenum. On the anterior wall of the duodenum. Okay, so I hope you got an idea about the sites of peptic ulcer, specifically of gastric and duodenal ulcer. Then next is pain. Okay, where you can find the pain, which area of the stomach or abdomen you can find the pain. So the pain is usually found, specifically in gastric ulcer, if you see, it is usually found in the epigastric region. So I hope you already know about the 9 quadrants of abdomen. So they are right hypochondriac, epigastric, left hypochondriac, right lumbar, umbilicus, left lumbar, right inguinal, hypogastric and left inguinal. So these are the 9 quadrants of the abdominal wall. So here what you can do is the main site of pain in gastric ulcer is the epigastrium. Okay, so this is the area where the patient gets pain. Okay, that's specifically in gastric ulcer, and this pain again can radiate to the back portion of the patient. Okay, it can go again to the back side, it can radiate to the back. Whereas in the ordinal ulcer, the pain is usually felt in the epigastrium and it can always be present in the epigastrium. Okay, so I hope you got an idea about the location of pain in gastric as well as duodenal ulcer. The next heading is Molina. Molina is defined as blood in stool. So in gastric ulcer, the chance of getting Molina is 40%, whereas in duodenal ulcer it is 60%. Next, onset of pain. So when the pain starts, in case of gastric ulcer, it usually starts immediately after eating food. That is, it can take at least within 30 minutes of ingesting food. Within 30 minutes. And in case of duodenal ulcer, it is 2 to 3 hours of food. That means 2 to 3 hours after eating food. Next is hematemesis. Hematemesis is blood in vomitus. So this chance of this is in gastric ulcer it is 60%, whereas in duodenal ulcer it is 40%. And aggravated, like what are the factors, like when this pain gets aggravated? This is something which is relating to pain. So the pain, the abdominal pain starts soon after eating food in case of gastric ulcer, and in case of duodenal ulcer it is when the patient is hungry. Okay, so when the patient is hungry, the person gets stomach pain or abdominal discomfort in case of duodenal ulcer, and this is like usually asked in many of the competitive examination. And pain is usually relieved by vomiting in case of gastric ulcer, and in duodenal ulcer it is relieved by eating. Okay, so one important point which I want you to remember is specifically in gastric ulcer, since pain is caused due to eating, that means having food will increase the pain, the patient will try to refuse eating food. Okay, so this can result in loss of weight, as well as this particular pain is relieved by vomiting. So because of this reason, the patient can have more and more loss of fluid as well as electrolytes. So patient becomes more weak in case of gastric ulcer than duodenal ulcer. Okay, next is appetite. The appetite of the patient, specifically of a gastric ulcer, usually will be poor. I already explained the reason for that. And in case of duodenal ulcer, it will be good. And in regarding weight, in gastric ulcer, weight is usually lost. And in duodenal ulcer, it can be either normal or it can be, there is a chance of weight gain, because the patient gets pain when he or she is hungry. Okay, and eating food can relieve the pain. So because of this, patient can have more food because it relieves the pain. This can result in a weight gain, or even it can also make the patient to have a normal weight. Okay, so this is all about the difference between gastric and duodenal ulcer. I hope you got a very good idea about this. This is one of the important question in many of the nursing competitive examinations, so please learn more about this particular topic. Okay, so if you are a new viewer, if you really like this video, please press the like button, and also you can better subscribe to my channel so that you can watch different new videos which I upload in my channel. So I hope you got a good idea about this topic. Thanks for watching this video. Bye.